Hi, welcome to Circus Animal. In this captivating podcast, we'll explore the intricate dance between patients and the medical system, a performance that often feels like jumping through hoops. Hence, Circus Animal. So, we realized yesterday that we told you nothing about ourselves. We didn't introduce ourselves properly. And we didn't tell you our real history, I don't want to I could talk for hours about how it started, but um, we just want to tell you a bit about our history and kind of the illnesses we have and just share that this is a safe space. Carly?
And we know how isolating chronic illness can be. We finally met after being in a chronic illness support group, and kind of we wanted to do something for everyone so everyone can kind of be included in this. Like I said, we know how isolating it is. So this is a place where we can all talk, get some good advice, and you can really experience with us things that we've been through so you know that you're not alone.
And you're supported. You're very supported in this space. We are
Safe space.
very supportive people who love to watch Housewives and Below Dick and
Yes.
every other time. Oh my God, just quick. Southern Hospitality.
Oh my God.
Oh my God. Okay, that's all. Oh my God. Like, I don't know who has friends who does that in their friendships. I don't do that.
I have, yeah. It's very, every time I watch it, I'm just like, it's a new low. But
So
it's a good thing for me because it's entertaining.
entertaining. And Vanderpump is going to be different because Vanderpump, that cast is
They're
over.
getting all new cast.
Right.
We
So
also like to talk about Bravo, so just be prepared for that.
we love Andy Cohen.
Yes.
We
He's our saving grace.
He is our like patron
Patron
saint.
saint.
He's the patron saint for the Jewish girls
Yes.
and all the girls. So
Especially the chronic illness girlies.
the chronic, for sure, the chronic illness community. Um, so I wanted to talk about my story really quick, which is never quick. But in 2008 or 2009, I got full blown mono as an adult. So I didn't work for six
It's
months.
not.
I was a freelancer. I made TV commercials for a living for 22 years as a production manager slash supervisor, whatever you people call it now. Um, and it I lost my place already. Thanks, fibromyalgia. Where was I? Carly,
That
help me.
you were a production assistant for 22 years.
Production manager for 22 years, right. And so in 2010, I had Lyme disease from working on a job. Came home with 10 ticks on my body, not a bullseye in them, and did get Lyme and took another year to get back to normal. And then in 2014, all hell broke loose when I stressed my body out to the point of having mono for a second time. And when that happens, you
All hell breaks loose.
yeah, I when you breathe the air and you are immunocompromised and you don't know you are. So I got another thing called HHV6. Google it, I can't explain it. But those two diagnoses, chronic EBV, which is Epstein-Barr virus, plus um, HHV6 equals MECFS, which is it's myalgic encephalomyelitis chronic fatigue syndrome, which is not funny or not real. It is very real. Um,
Of
and
course it's
so
real.
the first doctor I saw was my GP with guns out, hysterical crying because I was on a vacation for the first time in 8 years and was sick the entire time and dropped 15 pounds. And what ended up
Oh my
happening from that appointment was seeing a spine specialist because my neck was so out of control. And my back was out of control, and my everything was out of control. The whole body was out of control, and so she recommended a spine, and I picked Dr. Levine as an infectious disease, and she was the first specialist I saw. And here's the thing about
God.
Dr. Levine:
Wow. Good for you.
it, everyone asks me, how'd you find her? And I found her through my wonderful chiropractor in Brooklyn. She gave me her name and another doctor's name, and I picked her. I picked her myself. Even my GP was like, how'd you find her? And I'm like, everybody asks now. And I'm like,
Secrets.
it was great that I have her. I mean, I never thought I wouldn't be believed. And so it's so crazy to me that now so many people I know through either friendships or chronic illness support groups, that they don't get believed. I never
It's a
thought in
big
a
thing.
million years I wouldn't get believed. Like it never dawned on me. And Dr. Levine listened to everything I said. I told her the whole history from my mother's pregnancy with me up until the present moment. She tested me accordingly, like, 17 vials, and which is what goes on with infectious disease. And then she diagnosed me. And then the next doctor I saw was rheumatology. And she said psoriatic arthritis, ankylosing spondylitis, later on, it's ankylosing, not too that far along, and fibromyalgia. See, I don't look sick, you don't look stupid. Because invisible, you don't see invisible, and you just don't know how people feel.
Very
Um,
true.
and then the domino effect just kept going, and now I'm up to 29 specialists, and it's crazy.
Jesus.
Like you're just portioned out as, and people can relate to this. You are portioned out in body parts. Like instead of being seen as a whole human, and I have few doctors that really see me as a whole person, which is great because not a lot of doctors are, they'll tell you like you're crazy. It's only because they're afraid of you or they can't, you're too much of a challenge for them.
Very.
And I
They're
also,
out of their jurisdiction, so they just put it on you and say that you're crazy.
right, exactly. And those are the doctors. And I have to say, living in New York, we have a million doctors, and there's so many people all over the country, even in our own state, that have no access to doctors because there's not enough doctors
Yeah,
where
we're
they
really
live.
lucky.
I know. Well, lucky, and we're lucky we were born here. I thank the universe
Yeah,
every day for being born in New York, but I realize I could have been born anywhere. So I'm very
yeah.
grateful for that. But that's kind of my story. And the domino effect of illnesses has gone on forever now. And my list has about 28 or 29 things on it now. And I know I don't look sick. And people are like, you don't look sick. And I say, fuck you. Because I don't look sick. You don't look stupid. Looks can be deceiving. You never know who you're talking to. So, Carly,
Very
tell us, please share your story. I want to hear it.
So I've been sick for quite a while. I always had really, really painful periods. And so finally, when I went on birth control at around 19, and I was talking to my gynecologist, they were like, that sounds like endometriosis. The only way to adequately diagnose endometriosis is with a surgery. So that started my first surgery. And when she did it, which was in 2012, she was like, yeah, I got what I could, but your case is too advanced. So we need to move you to the next person. That happened 4 times because I've had 5 surgeries for endometriosis now. The last one in 2018,
You're
I'm in New
young.
York.
You're so young to have that all
I
happen.
know. The last one was in 2018. I flew to Georgia to the Center for Endometriosis Care. They have a whole really, really great like uh like procedure where they do just a lot of stuff. They're able to really go in and get kind of all the endometriosis in there. When I was in there, there was a woman from Turkey and a woman from Africa in the
Wow.
waiting office because that's how like good they are. It was Dr. Oh gosh, I can't remember his name right now. Dr. Severno. He was my surgeon. He was great, great, great. I can't recommend him enough at the Center for Endometriosis Care in Georgia. I know it's a pain in the ass. I had to take out a loan. My mom took out stuff. She has nothing left in her 401k now. So like we're kind of living on just like our like very depleted income, so it's not great, which is another hard thing that we have to deal with when dealing with chronic illnesses. It's the money because not everything is covered by insurance. A lot of the endometriosis surgeries and treatments were not covered, so that was paid out for by out of pocket, which is just
Oh,
awful. I have some
sure.
doctors now where it's like $400 an appointment, but they're a specialist and they're the specialist, and it's like, what can I do? I have to do it. So that's my endometriosis. And then I was kind of getting a little bit better from that. And then in 2023, I was going away for my birthday and I started just moving and I couldn't stop. And we almost like crashed the car because of how my movements were like affecting my mom's driving. We were going away for my birthday. And that's how we kind of got to the movement disorder doctor. But even before that, in 2023, I had serotonin syndrome from a medicine that I was on. And so I was in a coma for like 2 weeks. But while that was happening, I was horribly, horribly hallucinating, really, really scary hallucinations of me being like tied down, of having like experiments done on me. Like it was really awful. And I had what's it called? I was in the hospital for 5 weeks then because I also had rhabdomyolysis, which is now all the rage on the medical TV shows. It's killing people because it's like your kidneys going crazy. What happened with me is it attacked the muscles in my legs, so I had to relearn how to walk because I just had no strength in my legs. It attacked the muscles, and so I was in the rehab unit for like 4, 5 ish for I'd say 4 weeks because I was in the hospital overall for like 5 or 6, relearning how to walk again. We still had people come to the house afterwards and kind of like still like work with me, but it was very much so still not good. And then after that, I had to stop working because like not being able to walk kind of stopped you from being able to do that. Beforehand, I was a community habitation worker. So I worked with people on the spectrum, helping them be a bit more independent, which I loved. I loved the relationship that I had with all these people. It was really, it like did something for my heart. Not saying that that's the reason to do it. It's to do it to, help people. But on the other side of
There's good selfish, and that's the good selfish.
yeah, exactly. Like when because I worked with some nonverbal people, and when they would show you that they cared, it brightens you up and it warms you, and it's like the one of the greatest things in the world. And now it really like affects me that I can't do that and I can't work with the people who I made a relationship with. Um, but so then after that, then I was having really, really bad back spasms and I broke my leg really bad. I broke my tibia and my fibula. So I had to get emergency surgery. I was rushed to the hospital. And then 2 weeks after that, I got spinal fusion surgery. So I was in the hospital for 5 weeks, once again, learning how to walk again because of my leg, learning how to kind of use my neck in the right way. But still, like I got an MRI recently, and my neck is worse in worse shape than it was. I have degenerative disc disease. I have what's it called? Arthritis in my back and my neck. I have
Yes, you do. Now you
herniated
do. What was the last one?
bulging and herniated discs in both the back and neck, and then some of the bulging discs are on the nerve root, which is what causes a lot of my bad pain. I also have movement disorder, which is, I don't know if you can see me moving, I'm moving right now, and that's been really hard. And I'm also dealing with chronic insomnia. Like I did not sleep at all last night, so everything kind of come
Well,
together.
good.
Just
You look good for a girl who hasn't slept. I just have to say.
thank you.
Well,
Like doing makeup is my only kind of reprieve, and like doing my hair, it's just like it's the one thing that like I mean I burned my head doing it, but like it's the one thing that like I don't know, it makes me feel somewhat normal, so I still kind of try and do it as much as possible. A lot of times Andrea see me just with my hair in a bun. Um because that's a messy bun is like a chronic illness girlie's favorite go to. So um I just do that a lot, but it's been a lot of working with doctors who, once again, don't believe you. Another thing that I would strongly advise for is if you can have someone with you when you go to doctor appointments or specifically hospital visits, especially if you're young. I have a nose ring, so I'm pierced and young, which makes two things against me, which makes me seem like or look, they think that I'm a drug seeker in the hospital. All I want is sleep meds. I don't even want pain meds. Um, but it's been a real struggle. So that's why we're here to kind of help, hopefully, people not have to struggle as much.
and this also, this project for me, which I've been talking about for years and finally doing it, which is, I'm so happy to be doing it. And I'm happy to be doing it with you and happy to have anyone and everyone on this thing is really,
Yes,
for me, it's like a good selfish because I mean, when I had to stop working in 2014, I thought like, there's got to be more to life than just sitting at home and feeling like crap or going to doctors or, just feeling, isolated or whatever. So
super
this for
isolated.
me, this project, this Circus Animal project is like delicious for me.
Yes.
The way that I can give and hopefully help and I didn't wear makeup on purpose today because I know so many of us and I do put on makeup sometimes, but so many days I don't because do I care? No, not
I'll
really.
even put on eyeliner when I'm going to the hospital because I'm like, no one needs to
What
see
about
this.
you? You're young. You're like, I get that though. I mean, listen, after my third knee operation, I've had four under the age of 32. I told the nurse, she said, "What do you want?" And I said, "My bra."
Nah,
In 25 years, I've never heard anybody say that. And I said, "Well," and I was young, I was in my 20s. And I said, "But there are doctors here and they might be cute. I don't want to look all
yeah, exactly.
not
I was
like
putting on makeup
talking
even
turkey."
I
So,
was putting on makeup even when I was in the rehab ward and I couldn't walk. I'd wheel myself into the bathroom, be like, oh, but like put it on. I can do it. I can do it. I did it.
there was I don't really love isms and I don't love sayings and I have a thing, but it's my own personal problem, and I realize that. But saw a female cancer survivor, breast cancer survivor, say this, and I thought, you know what? She's right. When you feel like a penny, look like a million. But that's for yourself. My issue, and I have this issue, is that I don't know how to make the sick girl, the inside girl, look like the outside girl, and I'm not so sure I want to look sick all the time,
Yeah.
but it's what people see.
Yeah. It can be helpful. Like I have the parking pass and I'll get such bad looks except for when I'm using my cane.
Oh God,
Then
no
they're
one does
like,
a thing. I wear that giant brace on my leg for the last
yeah.
2 years, like no
I'll
one
be in the what's it
do
called, the
something.
handicapped restroom, and I'll be getting such like originally I'll be hearing such horrible things because they think it's just like an average Joe going in there, and then I'll walk out and I'll have my cane, and they're like, "Oh, oops, so sorry, I was saying such derogatory things about you." It's like maybe you should fucking like look before you make these comments and assumptions.
You're right, exactly. Well, people, they're so superficial and judgy. And I'm not saying I'm not superficial and judgy sometimes too, but only when it comes to like the red carpet. That's like,
Yeah.
I'm a Joan Ranger. I'm still a Joan
Oh
Ranger.
my God, yes,
Joan, that's what
love her.
love, miss,
Yes.
and miss her everything. And I agree with her about side boob. I don't want to see your side boob unless you're hoisted up in there taped up high. If it's drooping, I don't want to see it. She's right.
I don't disagree with that. I would have loved her at the June press tour, seeing Zendaya,
Oh,
watching all of her looks. It would have been amazing.
she's just so gorgeous, and her body.
Right? Oh my God, I'm obsessed.
Well, when she introduced Cher at the induction this year for Rock and Roll Hall of Fame, she was wearing one of the dresses, the Bob Mackie dresses that Cher wore, and she just, with she had like the 40-inch hair. So
She has an image architect, as they call him, Law Roach, and I'm
oh
obsessed
yeah,
with.
I know him.
Yeah.
Yeah, I know. Yeah, uh-oh. You know what? It's telling me we're running out of time.
Oh, okay.
Well, sorry, circus animals out there, but we'll be back tomorrow probably.
Yes, definitely.
I'm glad we got to tell you who we are, and feel free to share any comments you want to be on, you want
Any
to
questions?
questions, yeah, you need any help. We're here for that. So
Yeah.
good to see you, Carl. You look
Good to
beautiful.
see you too, Andrea.
I hope you get some rest and
Thank you.
give Will Ferret my love.
Yes, I will.
Okay. All right. Talk to you later. See ya.
Okay, bye.